Failing the NCLEX even 3 times can shake your confidence, but it does not define your future as a nurse. All it means is your current strategy isn't working and it's time for a new one. Today, I'll show you the steps to turn repeated NCLEX failures into your comeback story. I'm Nurse Miriam. Welcome to the Nurse Career Blueprint channel. Before you open another book, give yourself permission to feel the disappointment. Take a weekend to process. Cry, vent, do what you need. But then make a conscious decision to let it go. Shift from why did this happen to what's next. Remember, this is not failure. It is data for your next move. Do not just study harder, study smarter. Identify your weak spots, knowledge gaps, test anxiety, poor strategy, or rushing. Analyze your NCLEX candidate performance report in detail. Find the categories where you're below standard. This is not judgment. It is your roadmap. We'll use it to target your weaknesses head on. Passive learning does not work. Ditch endless highlighting and video marathons. Teach concepts out loud. Do daily practice questions and review every rationale. Build mental stamina with full-length time practice exams. Focus boot camps on your weakest subjects. Active learning is your new strategy. Or mindset is everything. Walk in expecting to succeed, not fail. Treat each question as a single patient scenario. Focus only on that moment. Practice this one question at a time approach during study. Celebrate small wins to build confidence. On test day, repeat, I am here to think like a safe, competent nurse. Exam day success starts the night before. Get real sleep and don't cram. Eat a balanced breakfast, arrive early and set a calm tone. During the test, read each question, stem twice and highlight keywords. Use process of elimination and do not dwell on tough questions. Always choose the safest answer and move on. Take scheduled breaks to reset your mind. Small habits can prevent big mistakes. Do not go it alone. Support and accountability are game changers. Join a prep course, find a study partner, or connect with a mentor who's been there. Share your struggles and wins. Let others lift you up. The right team will remind you of your strength and purpose. Please remember to subscribe. Leave your comments below. Think like an athlete. Every failed attempt is a training round, not a defeat. You are not starting from scratch. You are starting from experience. Use what you've learned to adjust and come back stronger. This is your final training round. You are ready. I once worked with a student who failed 3 times, but with a focused plan and mindset shift, she passed on her 4th try. Failing is not the end. It's a plot twist. What matters is what you do next. With targeted strategies and resilience, you can turn failure into success. The NCLEX tests for safe nursing practice, not perfection. Your future as a nurse is still waiting for you if you are ready to rewrite your next NCLEX story. Download the free NCLEX Ultimate Study Guide at nursecareerblueprint.com and start NCLEX preparation with a plan that works. See you in the next video.
Reality check. According to NCLEX statistics, U.S. students have an 88.2% pass rate, and international first-time candidates, 46.8% pass rate on the first try. And the data shows concerning patterns for repeat test takers. Repeat U.S. candidates, 53.2% pass rate. Repeat international candidates, 30.2% pass rate. Let's be brutally honest about what these statistics actually mean. First-time U.S. students, 88.8% pass rate. That sounds great until you realize that 1 in 9 students who just spent 4 years and probably $100,000 plus on nursing school fail on their first attempt. But here's where it gets ugly. Repeat U.S. students drop to 49.3%. That's a coin flip. After failing once, you're literally gambling with your entire career on your second attempt. Internationally educated first-timers, 46.4%. Less than half pass. Think about that. Highly educated professionals who've already proven themselves in their home countries are failing at nearly a 54% rate. And repeat international students, 29.9%. That's not even 3 out of 10. These are people who've dedicated their lives to nursing, and the system is essentially telling them, good luck, you'll probably fail again. So there you have it, the numbers that nursing schools don't want you to see plastered on their websites. Because here's the thing, you don't get a participation trophy for being a great nurse if you can't pass this test. And you don't get to help patients if you're stuck in the 51% who fail their repeat attempts. Check out my study guides at nursecareerblueprint.com. Don't let a standardized test determine whether you get to live your calling as a nurse. The pass rates don't lie. The question is, which statistic do you want to be part of?